Hello everyone, Dr. Kainat here.
And today we are going to talk about the other causes of anemia.
And now we have to move toward the next thing. If RBCs are producing properly, the second cause is hemolysis or destruction of RBCs. And there are basically two main factors. The first one is the intrinsic factor and the second one is the extrinsic factor. Intrinsic factor means the thing that is going to happen inside the body. There is no involvement of other things that are present outside. And extrinsic factor, the outer factors from the body that can cause the different diseases. Let's start all of them one by one. The first one is the intrinsic RBC defect. That can cause a membrane defect or hereditary spherocytosis. So what will happen in this? It's a genetic disorder in which the membrane that has a protein, spherocyte, that is going to be affected. If that membrane is going to be affected, it will cause anemia. It will change the shape of from the biconcave shape of the RBCs to the spherical shape. And these spherical RBCs are more fragile and get destroyed in the spleen, leading to hemolytic anemia. So this is the one more type of the anemia, that is the hemolytic anemia. The next one is enzyme deficiency. Which enzyme deficiency? Glucose 6-phosphate dehydrogenase. That is involved in protecting the RBCs from the oxidative stress. So if deficiency will happen, oxidative stress will break down the RBCs. The next one is hemoglobinopathy. Hemoglobinopathy can include two diseases, sickle cell anemia and thalassemia. In the sickle cell anemia, the HBB gene is going to get mutated, leading to abnormal hemoglobin. And these hemoglobin under low oxygen, RBCs form a sickle shape. These sickle shape can block the blood vessels, they can cause severe pain and cause organ damage. The next one is the thalassemia. Thalassemia is a group of inherited blood disorders caused by mutation that reduce the production of alpha and the beta globin chain of hemoglobin. And this leads to the microcytic anemia. So this is the next type of anemia that is called as microcytic anemia. The next thing that is going to decrease the production, so that is going to increase the breakdown of RBCs are the autoimmune hemolysis. A condition where the immune system mistakenly attacks its own RBCs. Again, they are going to move toward the destruction of RBCs. These are the four intrinsic factors. Now we have to talk about extrinsic factors. So there are basically two extrinsic factors, infection and the drug-induced hemolysis. Infection can cause like the malaria. Malaria is going to destroy the RBCs and move out. Second thing are the drug-induced. The drugs can also cause hemolysis. And which drugs can cause it? Like the drugs like sulfonamide, antibiotics like nitrofurantoin, they can increase oxidative stress that lead toward the RBC destruction. There is a third factor, that is the blood loss that can cause anemia. So there are two types, acute blood loss and chronic blood loss.
Acute blood loss reasons are any trauma, surgery, or GI bleeding, whereas chronic blood loss can happen because of heavy menstrual bleeding in the females and the GI bleeding if there are hookworm or any ulcer. Hookworm will suck the food or the blood from your GI tract.
If you want to get more information, stay connected with us. Take care. Bye.